When you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining through. Keep on smiling, 'cause when you're smiling, the whole world smiles with you. Ba, 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 da, ba.
Hi, I'm Dr. Kenny Levine and welcome to Health Talk. Health Talk is a new show in South Florida. We discuss medical problems, dental problems, mental problems, attitude problems, health and wellness, in all aspects of your life. I'm a periodontist. I trained in dental school and then went on for 2 years of additional training, and now it's 3 years. And primarily, back in my early days of my career, I treated periodontal disease or gum and bone disease. It used to be called pyorrhea. Back then we were concerned with maintaining teeth. We weren't concerned with aesthetics. We weren't concerned with replacing teeth with dental implants because we didn't have them. Basically what our goal was to maintain the teeth, good health and function for the rest of their patients' lives. Today we have another aspect of our care. We're concerned with cosmetics and aesthetics. People not only want to have functioning, comfortable teeth, but they want to have teeth that look good. Now, I've been doing this for almost 40 years in South Florida, and I had a lady say something to me last week that was so poignant, so simple. She said to me, quote, "I have a broken smile," end quote. I sat back, took a breath and said, that's an amazing statement because it describes so many concerns that people have. This 53-year-old beautiful lady told me that because of this, she didn't have confidence. She didn't have self-esteem. She couldn't function in a professional environment. Certainly it affected her personal relationships, the way she reacted to people. She was concerned. When she spoke with me, she spoke with her hand in front of her mouth. My goal will be for her, as it is for all my patients, to maintain her teeth in good health, good function, and good aesthetics for the rest of their lives. This is not only a problem for adults, it's a problem for children. When our kids start to lose their teeth, they're worried about the spaces in their mouths. When our teenagers are going through braces, they're worried about how it looks. In fact, when my kids had bar and bat mitzvahs, they wanted their braces off for their affairs. Today, however, braces are the trend. And when they can be different colors, the bands can be different colors for their favorite sports teams. And my granddaughter was visiting and she was very concerned because she lost one of the colored elastics for her braces. She wanted to get back to her orthodontist in New York to have that taken care of. Teenagers are concerned. They're ashamed of their appearance. They may have discolored teeth. They may have missing teeth, whether it be because they lost a tooth to decay, they lost a tooth because of trauma, or many times they never had teeth. They were congenitally missing teeth. Imagine being a young teenage girl or an older teenage girl having to go off to college with a removable appliance in their mouth because they're missing teeth for their entire life. They hide their smile. They can't socialize properly. They're very self-conscious. Adults of all ages have concern with their aesthetics. The smile is the most contagious thing when you walk into a room. People notice your smile. And if you're concerned about your smile, you're self-conscious. You don't have confidence. It affects their work. It affects their social life. Certainly, people who are out and dating have to have a healthy, attractive smile. When people think about smiles, they think about big white teeth. But a beautiful smile is not just big white teeth. It involves the shape of the teeth. It involves the shape of the gums. The relationship between the gums and the contours of the teeth and the lips. All these things go into making an attractive smile. So you can have somebody with big white teeth and have a very unattractive smile. In our office, we deal with the shape of teeth. The restorative dentists that we work with in our team approach make the beautiful teeth, but we're responsible for creating the proper level of gum related to the shape of the lips. We have techniques today whereby we can make long teeth shorter, where there's been recession, where somebody gets long in the tooth, we can make it better. We have teeth that are short, we can correct gummy smiles, and we can also correct situations where people have hypermobile lips and they give this big smile like a horse, and we can correct that with our laser. So, in summary, a beautiful smile is more than just beautiful teeth. It's the shape of the lips, the gums, and the whole thing together, the whole enchilada. So, we're going to be back in just a couple of minutes. I'm going to introduce you to one of my guests. This is Dr. Kenny Levine with Health Talk, and you can see us streaming live on the web, www.tvchannel19.com. Be back in a moment. Thank you.
Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu. You haven't smiled at me today when I was blue. Guess what happened then? I started smiling too.
Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. By the way, we're streaming live on the web at www.tvchannel19.com. My guest this evening is someone I'm not exactly sure what she does. We're going to find out exactly what she does. She is a life coach. I'm here with Kathleen Matchunis.
That's correct.
Kathleen, welcome to our show.
Thank you so much for having me.
You know, let me start off with a basic question. What is a life coach?
A life coach assists individuals to identify, clarify, visualize, and accomplish their goals. I work with both adults and teens.
Okay, so tell me a little bit about what your background is. How did you get started in this?
My background is in education. I've taught both adults and teens, and I saw that although a lot of my students would progress academically, that they struggled with different personal issues in their lives. And I wanted to assist with that. I love to see people make personal growth.
You said that your background is in education. Give me a little bit of
Okay, I
insight
taught
into that.
Spanish and French, and I also put together a class in peer counseling. I kind of infused it with conflict resolution and mediation, and I did this at the high school level. We had a very successful program where we had student mediators, and I'd say about half of the students joined the class because they really wanted to feel more peaceful and learn how to deal with personal issues in their lives. And other students really wanted to reach out and help other people.
I would imagine that's very difficult for a student to admit to having an issue with these problems, especially for a macho guy.
Mm-hmm.
What percentage of students, teenagers, do you have that are boys and girls?
Well, in the beginning, it started off with probably more girls than boys, but at the end, you know, when I was finishing up my program, it was pretty evenly divided, I would say, and I think I gave the students a safe environment in which to express their feelings. And it was a great leadership position to be a mediator.
Do you find that students, children, teenagers would open up in this environment more than they would, say, with their parents?
Yes, because we would kind of set the stage where we would have a lot of honesty. We did a lot of activities where we would build up trust, and students were very happy sharing their problems and different challenges in their lives with other students who had maybe gone through similar issues.
Now that you have established that in the schools, you have established a private practice where people come to you as individuals with this?
I work both on individual level with adults and teens for the life coaching, and I have a special program called Skills for Success where I work with teens in groups, usually of 4 to 6 teens, and we're able to maximize the social interaction because I'm really trying to strengthen their confidence in social situations so they're able to interact with me and each other, and if we're usually meeting in a public place, so then if we're in a shop or a restaurant, they will interact with the server as well. So they have lots of practice. I find that the more that students and adults practice social skills, the stronger they become and the more confident they become.
Is there a relationship between IQ or intelligence and the issues that you're dealing with?
Not really. I've dealt with many brilliant clients that socially were really very ill at ease. And I deal with students who are just shy, lacking confidence, and I also deal with students who are suffering from Asperger's or living
Right.
with Asperger's
Right.
or high functioning autistic, and I make a lot of progress with them. And in fact, they're mainstreamed with the other students, and it's very beneficial.
Are you talking about a situation where you're working with them in school or
No.
outside school?
We work outside of the schools since I have a private practice, and we make it like an outing, a social outing, because a lot of these kids who are shy or lacking confidence don't have the opportunity to go out with other teens. So we'll meet at a coffee shop, at a yogurt shop, go to a movie, go to a bowling alley, and we'll have our lesson and we'll have our social activity infused into the whole outing.
You know, for me this is fascinating because when I grew up a long time ago, none of this was recognized, talked about, or treated. And we're going to get more into this in a few minutes. So we're going to come back in just a moment. We'll continue with this discussion with Kathy Matchunis, and we're going to go over what she does, and we'll talk a little bit more about how it relates to life today. This is Dr. Kenny Levine with Health Talk. I'll be back with you in just a moment. Thank you. Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. Again, we're streaming live on the web at www.tvchannel19.com. I'm here with Kathy Matchunis, our favorite life coach. Kathy, when did you move from the school environment to a private practice? How did that happen?
It was a little over a year ago, and I have to tell you a little bit something on the personal side. I have twins, and one of my twins has a learning disability. Because of the learning disability, he never felt really confident socially, and I always wanted to have a service like this for him. And at that time, it was very difficult to find anyone who had a life coaching practice or a Skills for Success type of program. So I promised myself that I would want to do this in my retirement, and that was my motivation for starting my teen program. I also realized that by helping adults and the parents of these children, that I would also be helping the teens.
And how old are your twins now?
They're 20 years old, and they're successful juniors in college.
Now, we discussed the fact that I have twin granddaughters.
That's right.
And Anna and Morgan couldn't be more alike. One likes blue, one likes purple, one's got curly hair, one has straight hair, one likes to dress up as a little girl, the other one is happy to run around in shorts and a t-shirt. It's fascinating to me, the twin thing, how they can be so different. Your daughter doesn't have any of these issues?
Well, it's very interesting that you bring that up. She was the outgoing one in the beginning, and my son was very shy. And now, just when you think you figure your twins out, they like to change roles on you,
Okay.
just to keep things exciting.
I got
And so
you.
now my son is a little more outgoing, my daughter's a little shyer, and I think it'll all balance out in the end.
It probably will.
Mm-hmm.
Tell me how you get, or do you get parents involved in these situations?
Well, sometimes when a parent wants me to coach their child, I'll talk to them about their situation, and I'll talk to them about having a few sessions themselves.
By themselves or with their
By
child?
themselves, because I do work with adults on parenting issues, their own relationships, their self-esteem, their life-work balance. And I think if you have those things in balance, it helps you to be a better parent, and it helps you guide your child.
Got it. Now, do you have programs for adults alone?
Yes, I do. And adults who are not parents may want to have some guidance in professional issues, in finances, their own life-work balance, dating issues, if they're out in the dating world, wellness, spiritual issues. So anything that's a concern for them, I can help them identify their goals and get them to be where they want to be.
Interesting. So if somebody wanted to get in touch with you,
Mm-hmm.
they want to visit with you. Tell us where they can find you. Give us a telephone number. Give us a website.
The best phone number would be 954-294-9708.
And you're located where?
In Coral Springs, but I travel. I'm very flexible, and I have an office in Coconut Creek a couple of times a week. Sometimes I coach via Skype. If they want more information